Good morning. I'm John Silcox with the Fairfax County Health Department. I'm here with Sean Kiernan, who's a senior epidemiologist here at the Health Department. We're going to talk with Sean in a moment about what that means. But first, we want to introduce our topic today. We're going to talk about something you probably have been hearing about in the news lately, and that's measles. We're seeing some outbreaks throughout our country, particularly in the New York City area, but even here in the National Capital Region. There have been cases in Maryland. So far in 2019, we've not had any cases in Fairfax County, but because of these outbreaks, we wanted to talk about what measles is and what people need to do to protect themselves and what the health department does when we do encounter measles cases. So Sean, thanks for being with us. Thank you for watching. We hope you'll like and share our video, and if you have any comments or questions throughout the broadcast, please leave them in our comment section under the video and we'll try to address them. So Sean, let's start by just explaining what an epidemiologist does.
So an epidemiologist is someone who studies the distribution of disease in populations. So one of our main goals as epidemiologists here in Fairfax County is to give recommendations to prevent the spread of disease within Fairfax County. That's the unit that I work in, the main goal of that unit.
Okay, and so let's talk about one of those diseases that you try to limit the spread of, which is measles. As I mentioned, we've seen outbreaks throughout the country. I think it's up to 626 cases already this year. And it's growing, and that's certainly the concern. So let's talk first a little bit about what measles is. What are some of the symptoms, and what should people be watching for?
So measles is a virus. It's transmitted through the air. So it's when an infected individual is breathing or coughing into the air. It's true airborne transmission. So it's a small particle that's going to sit in the air for about 2 hours after the case actually is in the area. That's why it's so infectious. The symptoms that we generally look for, the symptoms start with what we call a prodromal period, which looks like a kind of flu-like symptoms. It's going to be a high fever. You're also going to have runny nose, red eyes, a cough. That usually is about 3 days or so, give or take, and then a rash develops. A rash usually starts at about your head, works your way down throughout your entire body. The rash is not raised or itchy. It's a blanching, flat rash, red rash all along the body. That rash usually lasts again for about 3 or 4 days. That's the traditional clinical presentation of measles.
And because it's so highly contagious, it's so important that once a case has been identified that we try to limit that spread of measles as quickly as possible. So let's talk a little bit about what happens when a case is identified. What are some of the steps, the actions that the health department would take if a case is reported to us?
Yeah, so just taking a step back, measles is a reportable condition here in Virginia and across the country, which means that any clinician, healthcare provider, who suspects that they have a patient with measles would need to report that immediately to their local health department. We also receive lab results as well. Where we look at the lab results. If there's a positive result for measles, we'd also take a look at that, obviously, and want to make sure that that individual did or did not have measles. And that's kind of our first step to any investigation. It's seeing whether the person truly has measles. We apply clinical criteria, the ones that I just discussed. If the person does look like they have measles, that's when we start our investigation. As I said, a lot of people can be exposed to measles because if it's in a shared airspace, we can have a lot of transmission of measles. So our role in that is to follow up on every single individual who is exposed to that infected person. You're infectious with measles if you do have measles for 9 days. 4 days before your rash has started, the day of your rash, and then 4 days after your rash. So a very long window while you could infect other individuals with measles. So what we try to do at the health department is identify every location a person has gone to during that 9-day window and follow up with those exposure sites. So whether we put out a press release or we actually contact individuals, we talk to them about whether they've been vaccinated in the past, whether they've had history of disease. If they haven't, then we give them public health recommendations. Again, we're just trying to limit the spread of measles from one person to the next.
Well, thanks, Sean, and thank you for tuning in. We're talking today about measles and some of the outbreaks that are occurring throughout the country. So far in 2019, we've not had any confirmed cases here in Fairfax County, but we've had cases in the past, and so what you've been talking about is sort of our approach to dealing with measles cases when they occur. So let's talk a little bit about what people can do to protect themselves. So what is your #1 recommendation for protecting from measles.
Yeah, vaccination is obviously key when you're talking about measles. Measles vaccine is one of the best vaccines there is. It's the MMR vaccine, so children are generally vaccinated when they're about 1 year of age, as well as when they're about 4 to 6 years of age. So 2 doses of vaccine are recommended for all individuals in the United States. Usually schools require that for school entry. Measles vaccine is extremely efficacious, which means it's a very good vaccine. So if you've had 2 doses of vaccine, that means that you're 97% protected from measles in our community.
And here in Fairfax County, we do have a high immunization rate among our school-age population. It's even higher than national standards. So we do have a good vaccination coverage here in Fairfax County. But of course, we live in a region where there's a lot of travel. There's a lot of people who come and go, who leave the country often. And that's really one of the issues that's happening now with some of these outbreaks is people who might be traveling to countries where measles is more common. If they're not protected or vaccinated, they could potentially bring it back with them. So is that what we're seeing?
Yeah, so I mean, so kind of 2 points on this. As I said, measles vaccine is first recommended at 12 months of age. If you are bringing a child outside of the country, or if you are traveling outside of the country, please talk to your provider about whether you need to get more measles vaccination if you're unsure about your vaccination status. With measles vaccine at children less than 12 months of age, you can be vaccinated greater than 6 months of age. You just would still need to continue with your vaccination series. In regards to what's going on in the country right now, generally speaking, how measles outbreaks start in America is because we really traditionally haven't had measles transmission in America. The virus itself has been brought in from other countries, and then there's been a small amount of circulation here in the U.S. from secondary cases of this. What we found very recently is that this measles virus has found pockets of under-vaccinated individuals where the transmission has really proliferated a lot.
So again, our recommendation here is obviously making sure your children are vaccinated according to the recommended schedule. And then if you're an adult, you're not sure about your vaccine status, maybe talk to your doctor about getting vaccinated.
The best guidance is just talk to your healthcare provider. If you're really unsure about your vaccination status, you can have a blood test done to see if you're protected, but also a lot of times a physician just might recommend another dose of vaccine to make sure.
And certainly, as you said, if you are planning any international travel, check on your vaccine status. There are a number of vaccines you might need to get before traveling.
Yep, of course.
MMWR would be one that you would make sure as well. So thank you, Sean, for sharing this important information. Again, we appreciate you tuning in, and we hope you'll like and share our video. If you do have comments or any questions about this topic, please leave them in our comment section under the video, and we'll try to address them. Before we let you go, Sean, though, let's just cover what measles is again and some of the symptoms that people might need to watch out for. You mentioned it starting out as like a flu-like illness, so that can look like a lot of things. So what would you recommend people watch out for?
So again, it's a high fever. So we're talking about a febrile rash-like illness. So that's kind of the 2 big features. A high fever and a rash is the main components there. It's going to start out with respiratory symptoms, but then that full body rash is very clinically distinguishable for measles. So not many things cause a full body rash. So if you get that full body rash, obviously see your healthcare provider as soon as possible.
All right. Well, thank you again, Sean. We appreciate your time. Thank you for watching. If you have any other questions or want to get more information about measles, you can certainly go to the CDC website, which is cdc.gov, and there's all kinds of information and resources about measles there. You can also check out our website, fairfaxcounty.gov/health, for more information on the health department, what we do, and the services we provide. And again, I want to thank everyone for watching. We hope you will like and share our video, and we'll talk to you again soon.